who is the most merciful and the most beneficent. Assalamu alaikum. Welcome to my channel, The Smile Squad. In this video, we will learn about the topic local anesthesia in mandible. For this, first we have to know about the mandible and local anesthesia. Mandible. The mandible is also known as the lower jaw bone. It is the vital bone in the human face. It forms the lower jaw and holds the lower teeth in place. Anatomy of mandible. Body of the mandible. Body of the mandible is horizontal part of the bone. It is curved structure containing the lower teeth. Ramus. It is the vertical part of the bone connected to the body of the mandible. It is flat and broad, making the posterior part of the mandible. Here we have the body and it is ramus. Now, condyle of the mandible. The joint connecting the ramus to temporal bone of the skull. It is rounded structure and allow the movement of the jaw. Coronite process. A thin triangular structure that projects upwards from ramus. It is attachment point for muscles and ligaments. Here is the condylar process and the coronite process. Mental foramen. The mental foramen is the opening in the body of the mandible which allows the mental nerve to pass through it. Incisive foramen. An opening in the body of the mandible which allows incisive nerve to pass through it. Mandibular canal. It is the channel that runs through the body of the mandible containing inferior alveolar nerve and vessels. Here we have the mental foramen. Mandibular angle. The mandibular angle is the angle formed by the intersection of body of the mandible and ramus of the mandible. Mandibular notch. It is the curved depression in ramus. It gives attachment point for muscles and tendons. Here is the mandibular angle and mandibular notch. Now we will learn about the trigeminal nerve and its divisions. The trigeminal nerve has three main branches. Ophthalmic division, it is called V1. Maxillary division, it is called V2. Mandibular division, it is called V3. Now the mandibular division has several branches: inferior alveolar nerve, lingual nerve, long buccal nerve, myloid nerve, and auriculotemporal nerve. The inferior alveolar nerve provides sensation to the lower teeth and surrounding tissues. Mental nerve provides sensation to the lower lip and chin. Incisive nerve provides sensation to the lower incisors. Lingual nerve provides sensation to the anterior 2/3 of the tongue. Long buccal nerve provides sensation to the buccal mucosa and surrounding tissues. Myloid nerve provides motor innervation to the myloid muscle and the anterior belly of the digastric muscle. Digastric muscle is located in the neck. Auriculotemporal nerve provides sensation to the temporomandibular joint and surrounding area. Temporomandibular joint is the joint that connects lower jaw to the temporal bone. Now we learn about functions of mandible. The functions of mandible are supporting the lower jaw, holding the lower teeth in place, contributing to the formation of facial structures, controlling the jaw movement, facilitating eating, speaking, and other essential functions. Now, why it is difficult to achieve anesthesia in mandible? There are two reasons. As the cortical bone in the mandible is thick as compared to maxilla, and in maxilla the bone is porous, and in mandible the bone is compact. So achieving the local anesthesia in molar region is difficult. Here we see that the cortical bone is very compact and it is very thick. Local anesthesia. Local anesthesia is the type of anesthesia that numbs a specific area of the body, allowing medical procedures to be performed without the pain or discomfort. It numbs the area being treated, reduces the anxiety and discomfort. Types of local anesthesia. There are 4 types of local anesthesia. Topical anesthesia, it is applied directly to the skin or mucous membrane to numb the surface. Infiltration anesthesia, it is injected into the tissue to numb the area. Block anesthesia. Block anesthesia, it is injected into the nerve or group of the nerves to numb a larger area. Regional anesthesia, injected into the specific region of the body to numb a larger area. How local anesthesia work? Local anesthesia works by blocking the transmission of the pain signals from the nerves to the brain. The anesthetic medication binds to the nerve endings, preventing the release of the chemical messengers that transmit the pain signals. Common local anesthetics: lidocaine, bupivacaine, mepivacaine, and articaine. Lidocaine is used for infiltration anesthesia, nerve blocks, and epidural anesthesia. Epidural anesthesia is a type of regional anesthesia, involves injecting a local anesthetics in epidural space surrounding the spinal cord. It has the rapid onset of action, intermediate duration of action about 1 to 2 hours, and moderate potency. Bupivacaine, regional anesthesia, epidural anesthesia, and nerve blocks. Slower onset of action compared to lidocaine, longer duration of action 8 to 12 hours, and high potency. Mepivacaine, it is used for infiltration anesthesia and nerve blocks. It has the rapid onset of action, intermediate duration of action, and moderate potency. Articaine, it is used for infiltration anesthesia. It has the rapid onset of action, intermediate duration of action, and high potency. Choice of local anesthetic agent. It depends on patient factors like medical history, age, or allergy. Procedure factors like type of procedure, duration of procedure. For the short procedures, lidocaine and articaine is used for rapid onset and intermediate duration, and for longer procedures, bupivacaine is used for longer duration of action. Local anesthesia has made the dental procedures more pain-free. Local anesthesia numbs the area, reducing the pain and discomfort during the medical procedures. Increased patient comfort. Local anesthesia allows the patients to remain comfortable during the procedures, reducing the anxiety and stress. Faster recovery. Local anesthesia typically has faster recovery time compared to the general anesthesia. It is because it doesn't depress the central nervous system. The risk and complications can be allergic reactions, like some patients are allergic to lidocaine, articaine, bupivacaine. Next is nerve damage. The nerve damage may be due to the needle trauma or compression or pressure in the nerve during the procedure. High concentration of local anesthetics can be toxic to nerves. Next is infection. Infection can be due to the contamination or the use of needle not being sterilized, and can be because of bleeding at injection site can lead to hematoma formation.